COVID-19 long haulers, that's the term coined for those who have been experiencing symptoms long after that initial infection with the virus.
Fox 13's Sydney Glenn spoke with a young woman trying to manage her symptoms during all this haze, and why a doctor as well, why the bad air is impacting some more than others.
When Utah's mountains are masked by smoke and pollution.
I get up and I sort of look out the window and was like, okay, it's an inside day.
Benice Merrill knows better than to spend time outside.
So with all the smoke and the air, everything that's going down, it is worse than it has ever been.
Back in October, Merrill tested positive for COVID-19. Now, months later, she's experiencing long COVID.
A lot of things hurt. I didn't think that that would be sort of a constant in my life, at least for until I was like 90 and had arthritis.
Her two parents are also COVID-19 long haulers. Her mom even spent time in the ICU.
You don't really think about it, you know? You don't think about, oh, people are dying from this. This is terrible, until someone you love is on the brink and just sitting there, and you get like daily updates, and that's pretty much it.
Now, this bad air is making it worse.
And it's made it a lot worse. I'd say at least 3 to 4 times worse than it usually is. And also with that, my lungs have started hurting, which is not something that I had before.
Dr. Dixie Harris, a pulmonary medicine and critical care physician, says these toxins in the air are especially irritating for long haulers.
For these poor long hauler patients, it's getting way down in their what we call air sacs or alveoli, and it's irritating, inflaming, and then that adds to the inflammatory cells get revved up and can really cause some shortness of breath and inhibit the ability to absorb oxygen and get rid of carbon dioxide. So it really can very much impact the air exchange that needs to be happening.
Unfortunately, Dr. Harris says there's not much people can do except try to stay inside. But even that isn't a perfect fix.
Even the indoor air will start becoming polluted because there's only so much our home air conditioners can filter. The other thing is there's really not anywhere within a reasonable driving distance for patients to go to get out of it.
For now, Merrill has to skip her morning walks outside as she tries to find some relief.
I do a lot of talking to people. I love it. But with my throat feeling like there's daggers in there, whenever I try to open my mouth when I'm talking to people, it's awful and I hate it.
Dr. Harris says the simplest thing you can do when it comes to helping protect yourself against bad air quality is wearing a mask outside. She also suggests people check DEQ's air quality forecast each day. We have a link to that over on our website, fox13now.com. In West Valley City, Sydney Glenn, Fox 13 News, Utah.